Victoria. We saw so many patients today.
I know, Pearl. Ever since we took on all of those new docs that finished residency, we have been absolutely swamped. Look at all of these visits I had to check through.
That's a lot of patients.
Absolutely, Pearl. And each of these patients had different needs, different treatments, and this is where my E&M coding really becomes crucial.
E&M coding? What's that?
So E&M stands for Evaluation and Management. It is a type of coding that kind of categorizes the type and the intensity of care during a patient visit.
Oh, so like when Dr. S bills a 99214 for treating a patient for their migraine?
Exactly. And the number and complexity of problems, the data involved, even the risk or the time, those all factor into how we get that level of service for E&M coding.
So how do we figure out the right code?
That is a great question. Would you like to learn so that you can help me out?
I would love that. Maybe someday I can be a coder just like you.
Great. Let's go learn some E&M coding. Now, there's a lot of places for E&M visits. There's office or outpatient, observation, inpatient, nursing facility, even emergency department. But since we're office outpatient, we'll kind of start with that. With evaluation and management coding, we have different levels. So the more complex and more we're doing, the higher the level and the more it's reimbursed. But we figure out that level with 3 different things based off of our medical decision-making. So medical decision-making can be straightforward, low, moderate, or high. It all depends on the intensity of the case.
I see. So the more complex the patient's needs, the higher the level of medical decision-making?
Exactly.
Considering how many notes I'm taking, I might just qualify for extensive documentation on my own. Do you think that bumps me up to a high MDM?
Well, documentation may come into play because there is the consideration of time. And time includes time on the date of encounter that we spend doing things like documenting in the patient record.
So it's not just about what we do, but also how long it takes?
Exactly. And remember that each level of service is unique and it's not always interchangeable between different types of service. So for example, a level 3 office visit isn't the same as a level 3 inpatient subsequent visit.
Got it. So we need to be careful to match the right level of service with the right patient and situation.
Precisely. And that is how we ensure accurate and fair billing across all services. So are you ready now for a deep dive into evaluation and management?
Diving into coding, huh? As an axolotl, I'm used to murky waters. I bet I can find clarity in these complex codes just as easily.
I don't doubt it, Pearl. So this is the AMA medical decision-making grid. It is how we determine the level of service of E&M. I'm going to go over the overall basics before we get into the nitty-gritty details, okay?
Okay.
To figure out the appropriate level of service, we need to determine the appropriate level of medical decision-making. Now, every visit needs to have an appropriate history and exam, but we score it based on the medical decision-making.
What is medically appropriate?
It's a little subjective, but it should at least be something related to the problem, right? So if a patient's coming in for knee pain, we would expect to see an examination of the knee. It doesn't need to cover everything, but it should cover the components that are at least related to the presenting problem. So we talked about those 4 levels of medical decision-making: straightforward, low, moderate, and high.
What about that one that says NA?
That one means not applicable. Those are things like if a patient comes in for a weight check or a blood pressure check, and they don't necessarily need that physician intervention.
So they don't have to document anything?
Oh my gosh, they always have to document something. Even just from a good patient care or even a liability standpoint, we have to have a correct record of what happened during that patient's visit. The NA just means there isn't anything specific that they have to document to hit that level. It's just whatever was pertinent for the visit. Now, to meet one of these levels, we have to hit 2 out of the 3 elements of medical decision-making. And our elements of medical decision-making are number and complexity of problems addressed, amount and or complexity of data to be reviewed and or analyzed, and risk of complications and or morbidity or mortality of patient management. So for example, if we're trying to hit that moderate, we would have to hit 2 of 3 of the moderate number and complexity of problems, moderate data, or moderate risk of complications. 2 out of those 3 elements.
2 of 3. Wow, this is a lot. It looks like there's some 2 of the 3 in that data column, too.
Yeah, Pearl, E&M definitely has a lot of different layers to it. How about we meet again and we can go over the very nitty-gritty specifics of each of these columns?
Yes, let's column it a day. Do you think if E&M coders had a favorite game, it would be Column of Duty? Hey, Victoria, if we ever get lost in these guidelines, let's just remember, at the end of the day, it's all about making the right column.
Well, we'll definitely be going over more guidelines and definitions. There's still a lot more to cover.
And what are you going to do until then?
Well, I guess I'll just keep on coding on.